Well, we know that finding a good mental health care provider can be pretty tough on its own, and it can be even more difficult for people whose first language is not English. In the U.S., Hispanic and Latin American adults are actually 50% less likely to receive mental health care at all. So there's a new program that's popping up in Denver that's meant to help them. We have Dustin Hacker. He is one of the Spanish-speaking intensive outpatient therapists joining us now to talk a little bit more about the program. Dustin, good morning.
Good morning.
Talk to us first. You're with Guidelight.
Yeah.
What is Guidelight and what services do y'all offer?
Yeah, Guidelight Health, we're kind of an intermediary between inpatient and outpatient levels of care. So we have PHP and IOP program, kind of like a 2 to 6 week program. And really, we're just trying to bridge the gap between the inpatient and outpatient level of care.
What does this program look like?
Yeah, so Juntos Adelante is our new Spanish language IOP program. So it's our 6 week program, 3 days a week for 3 hours. And really, it's an entirely Spanish language program. So everything from the intake evaluation to all of our group therapy. We are a group therapy practice, so we're running groups in Spanish. All of our worksheets, our individual sessions, everything's gonna be Spanish language based.
What was the inspiration behind starting a program like this?
Yeah, so in Denver, 1 in 5 residents are Spanish speaking, and there's definitely a gap in care. So we want to bridge that gap. We want to provide mental health services for Spanish speaking residents of the area. And really, there's a stigma in lots of communities, whether it's based on age, based on generation, based on community and background. So we want to provide as accessible and equitable care as we can to the Spanish language community here in Denver.
And that stigma runs strong across many different cultures, but as somebody from the Hispanic culture, I can tell you that stigma is very strong there.
Yeah. So we're really trying to broaden the scope of what mental health and behavioral health access exists in the Denver metro area. And so we're here piloting this program. It's going to be the first Spanish IOP program in the Front Range entirely. So we're really excited about it.
How do you see this benefiting a lot of people?
Yeah, I mean, starting from reducing stigma, there's a lot going on in our community, across the community. And so our goal is really to bridge that gap. We want to provide group therapy, and we like this model because it creates a communal aspect. We want people to be able to talk to each other, feel like they're not alone in their experience, and as much as they can gain anything from a clinician or from our practice, they're really gaining things from their peers as well.
Yeah, absolutely. How long has this program been going on now?
So Guidelight, we started here in Colorado. We're originally a Massachusetts-based organization, but we started here at the beginning of the year, and we're piloting the Spanish IOP program. So by the end of the month, we will be up and running.
That is amazing. So a lot of people at home may be thinking, hey, I have somebody that I would love to send this information to, or maybe they themselves want to learn more about it. How can they get more information?
Yeah, guidelighthealth.com/juntas, JUNTAS, or you can call us specifically at our Central Park Clinic at 720-730-2523.
Have you ever been part of a program like this? Curious, have you modeled it after any other programs?
I haven't been a client, but I've been working for Guidelight, and I really like the group therapy model. I think it kind of bridges the gap, and there's a stigma in mental health, and so the group therapy model kind of reduces that stigma, and it shares kind of the experience. It reduces the lack of clarity of what the experience is, and it kind of brings down the stratification between clinician and client, which I think is a really key aspect of our program.
And being able to meet people where they are specifically and how they speak, that's a big deal.
Yeah, I mean, obviously in Denver, with 1 in 5 residents being Spanish speaking, but not having a lot of Spanish speaking programs, that's a huge gap. And so meeting the clients where they are in the language that they speak, it's likely to prevent them from avoiding the therapy kind of experience, but also we want them to feel comfortable expressing themselves in their native language and sharing that experience with their peers. And so that native language aspect is really a critical aspect of why we're starting the Spanish IOP program.
100%. Well, thank you, Dustin. We appreciate you making the time this morning to share with us about this. One more time for people who want to get more information on this.
Yeah, guidelighthealth.com/juntas. That's JUNTAS.
All right, Dustin, appreciate it. Thank you so much.